Welcome, everyone, to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Novavax from Roots Community Health, reporting for the week of May 19, 2025. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. After an update on respiratory viruses, measles, and H5N1, I'll provide some late-breaking updates on what's going on in health in the United States. Starting out with respiratory viruses, among patients presenting to a healthcare setting for testing, as of May 10th, the largest share of cases is made up of rhinovirus, enterovirus, which is in the gray. And then to a much lesser extent is human metapneumovirus in black, which just dipped down below parainfluenza virus in the yellow. Pretty much by all measures, whether it's percentage positive tests or wastewater or emergency department visits or hospitalizations, things are trending down for COVID, flu, and RSV overall for the time being. So we'll be watching out for those early indicators like wastewater and epidemic trends, which is a model based on emergency department visits that's trying to help us understand whether things are increasing or decreasing. When it comes to flu, the entire country, everything is decreasing or stable. When we look at COVID epidemic trends, we can see that it looks like in both Hawaii and Nevada, in that lighter purple, COVID is likely growing, and the rest of the country is mostly stable in gray or decreasing or likely decreasing in those shades of green. And so if you happen to live in Nevada or Hawaii, and this is something of interest, you can definitely look further into this. For example, I did take a look at Hawaii, and it turns out that not only ER visits, but also hospitalizations are indeed starting to head up for COVID. And if you're in those states, and you may want to take a look at wastewater, for example, in your area to see if you can get something a little more local that may apply to you. And these are all on the CDC pages, which are linked in the post. And taking a look at hospitalizations from COVID, flu, and RSV. Flu is in the blue, so on the left is the hospitalization. We see that it's really getting down to very negligible. On the right are deaths, and we can also see that the part of the line that is blue is decreasing and becoming much less significant. And so the orange, which is COVID, we can see that we definitely have more hospitalizations and more deaths from COVID than flu or RSV, but thankfully COVID is also continuing to either stay kind of flat or level. We haven't seen any upticks just yet. When we take a look at deaths, there have been 358 COVID deaths recorded so far for the week ending April 19th. It's a little bit higher than the week before that when it was 337. So hopefully that's just kind of a little blip within kind of the margin of error and not representative of the direction that we're heading. And I think that's likely the case because overall, we're not seeing increases in ER visits or hospitalizations that typically precede the increases in deaths. So overall, though, we are in the mid 300 deaths every single week from SARS-CoV-2, so still too many, but hopefully it will continue to come down. And so we'll just keep an eye on those early indicators so we can do our best to prepare as needed. And now for an update on the measles situation. As of May 15th, there are 1,024 confirmed cases, and that's up from 1,001 last week. So hard to say if it is slowing down or not, but cases do certainly continue to keep coming in, and these are just the confirmed ones. This does not include suspected measles cases. And of course, we know that measles, like any other infectious disease, does not know any borders. So this outbreak certainly stretches beyond the epicenter, which we know is in West Texas. It's including many states in the United States and also Canada and Mexico. And it does seem that these three biggest outbreaks in North America are hitting the Mennonite community in all of these three locations, Canada, Mexico, and the US. and these are communities which have lower vaccination rates. It does seem that the genetic strains of measles are matching in Canada to Mexico to the United States. So when you take a look at North America's three biggest measles outbreaks, this comprises more than 2,500 confirmed cases and 4 deaths, 3 in the US, 1 in Mexico. And even though these are definitely taking off in these communities with low vaccination rates, we know that vaccination rates are declining in many regions in North America, and measles being so highly contagious, we know that this is not something that is just going to be limited to one region or one community, as we're obviously seeing here. So now we've got a lot of people asking, what do I do? I'm not sure if I was vaccinated, or how do I really know if I still have protection? So I think first I would say it's not a bad idea to try to locate your immunization records. So if possible, try to dig those up and see and just confirm that you've had the 2 doses of the MMR vaccination. It does seem as though the guidance is kind of leaning towards, if you're unsure, then it may just be easier and cheaper to get a dose of MMR vaccine rather than get your blood drawn and checking titers, because then that's kind of 2 steps, and then you'd have to come back in and get an MMR vaccine if the titers were low. But this is something you can discuss with your primary care doctor. If you don't have one, please get one. And definitely, if you're planning any international travel or travel to an area with an outbreak, it's a good idea to talk this over with your primary care doctor, with your children's pediatricians. Make sure that you all are protected, in particular for the place that you are traveling to. And now for a brief update on H5N1 bird flu. So there haven't been any new cases in the United States reported for many weeks now. And as a reminder, there have been 70 human cases in the United States and 1 death. Out of those, more than half were transmitted from dairy cattle to humans. And then behind that is poultry to humans. I'll go over this in a little more detail in a moment. Over half of the cases in the United States, so 38 out of the 70, were in the state of California, where of course we do have quite a lot of farming. There was a recent CDC Clinician update on H5N1, and I shared a link to that in the post. It was mostly geared towards clinicians, but if you're interested in that, take a look. I'll share a couple of things. First, a little more about the 70 human cases that they shared, that all of the cases that were associated with dairy cow exposure caused a mild illness. So this was over 5 states, and the mild illness was the conjunctivitis or the pink eye and flu-like illness. The 24 cases from commercial poultry exposures were over 6 states, and those mostly caused mild illness, so also the conjunctivitis and flu-like symptoms. But the 2 cases that were associated with backyard poultry exposures resulted in severe or critical illness, including the 1 death. And the unknown exposures were either mild or moderate illness. In total, there have been 4 hospitalized cases, and those are in 4 different states, and 3 of those had pneumonia, which is the most common complication of H5N1. And as I mentioned, there has been 1 death that was in the state of Louisiana. So far, there's no known human-to-human transmission of H5N1. Now, one thing that they emphasize is that, as we kind of just went over, so far all the human cases in the United States are really from unprotected contact with sick or dead poultry, or unprotected contact with dairy cattle or raw milk. And notice I said unprotected. So a big part of the guidance here is that if your work entails close contact, then you should be wearing proper PPE. They also emphasize that we should be cautious in not consuming undercooked beef or consuming raw milk, but that strictly speaking, those are not considered risk factors for contracting H5N1 at this point. So these precautions are mostly based on just being cautious, based on kind of what we know, what we think, and also based on anecdotes. And given that this is a situation that has several unknowns, and certainly in the case of raw milk, there are a whole lot of other very serious reasons, infections that can result So it is discouraged primarily for those reasons, but again, also because with the H5N1 situation still evolving, then it would just be wise to be cautious there as well, since we know that if it's not pasteurized, there was an opportunity to inactivate the H5N1. They also reviewed ongoing surveillance in quite a lot of detail. Just a couple of takeaways that I'll share. One is a reminder that a lot of the surveillance that we've been doing has been because we've been in flu season. And so there's a lot of testing going on, a lot of subtyping going on so that we could really be doing the surveillance. And so it's great that there haven't been a lot of new cases added, but there's also a little bit of concern that is this because our testing is dropping off? So this is just something to keep in mind. And particularly as we head into summertime, we know that this is when there are agricultural fairs and camps and other settings in which there may be a risk of exposure. So what they're really asking of clinicians is that we think flu, even though it's summertime, and that we talk to patients about exposures and risks around H5N1. And this is important for clinicians that if there is a flu-like illness, then we really should be collecting specimens and sending them off for flu testing and subtyping, especially when there is a possible relevant exposure. And we should be asking our patients about these possible relevant exposures. And so along those same lines, if you, for instance, go to the county fair and then you get a respiratory illness that sends you to the doctor, you should remember to mention that you went to the county fair. And this is definitely not meant to discourage anyone from going to the county fair, because we really are mainly concerned with people who work directly with cattle and poultry. But still, given the fact that H5N1 is still an evolving situation, it has crossed over into humans, and we're getting into the time of year where there may be more opportunities for exposure among the general population. It's just something to keep in the back of our mind. So one of the big takeaways, again, was think flu, even though it's not respiratory virus season. And of course, we should also remember to think COVID, because unfortunately, every season is COVID season. And so if you are feeling unwell, then we should test to rule out COVID. And remember, with the antigen tests, we want at least 2 negative tests, and because that's when we start to get to a good level of accuracy on the antigen home test. So 2 tests 24 to 48 hours apart when you have symptoms. If you have access to the combo test with COVID and flu, that is even better. Definitely, if you test positive on antigen tests for flu A, please do take that extra step, go in and get a swab taken so that they can send it off for subtyping. And of course, if you are at risk of a bad outcome from flu or COVID, then timely treatment can significantly reduce those risks. Now I want to bring up the fact that yet another important safeguard regarding health has been apparently dismantled, and that is the Healthcare Infection Control Practices Advisory Committee, otherwise known as HICPAC. And this is reportedly in alignment with the federal reductions in workforce and the calls from various professional societies to keep HICPAC intact were seemingly ignored. The committee's web pages have been archived, which is a little concerning because there's guidelines that they put out that are generally the type that need to be updated. They don't stand still in time, but being archived means they are going to stand still in time, and there's not really a mechanism for those to be updated that we've been made aware of. And actually, there's a lot of evolving when it comes to infection control practices, especially in hospitals, because not only do we sometimes have new pathogens, as we are seeing not only with COVID, but with H5N1, but also we have strains of known infections that become drug resistant, for example. And so guidelines do change. And of course, knowing what we now know about airborne transmission, those guidelines also still need to be updated. In fact, HICPAC was reportedly on the verge of finalizing new guidelines on airborne transmission, but lo and behold, that is now stopped in its tracks. So the concern is that instead of lessons learned from COVID that could help improve safety in hospital settings and other healthcare settings, that things will just stay status quo. And so this is unfortunate because much like the ACIP and VRBPAC and other advisory bodies that I report on here frequently, HICPAC held public meetings and there was an opportunity for public comment, for the public to weigh in, and for there just to be transparency about how these guidelines on infection control are drafted and adopted. And so just as a point of reference, the committee has been around for over 30 years. They've made 540 different recommendations to CDC. 90% of those have been fully implemented. So really it is unclear that in the absence of this committee, what the plan is. Will there just be no transparency? Will these things be drafted in a vacuum? We just don't know. We don't know if this means we're going to be in a DIY situation where different jurisdictions will just do different things because we're not really setting a bar at the federal level. So it's possible that this disbanding of HICPAC will affect different regions differently because some places may already go above and beyond the floor set by the CDC and others may not. So it may just be even more piecemeal or patchwork, which I think is really unfortunate. So we will just have to wait and see where this takes us. I also wanted to briefly mention another development, which I find a bit disturbing, and that is that the U.S. Department of Justice has apparently been sending letters out to a number of scientific journals, asking a series of questions about whether the journals have a position that they're advocating for or against, and whether they accept articles from competing viewpoints. So in and of themselves, the questions are probably fine. If you or I or scientists or other people in the field would like to ask any of these questions in general, I think is fine. I think what's raising eyebrows is the fact that these questions are coming from the U.S. attorney. And the letter apparently mentions that the journals have tax exempt status. So that has a little bit of a threatening sounding element to it. So it's unclear how or if the U.S. attorney is planning to use its authority to do anything with the responses that they have demanded from these journals. But there certainly is concern that this is a type of intimidation and just another example of what appears to be interference with research and science over political reasons. So this is certainly not to say that journals can't be biased, but I think the question is whether this is something that the U.S. attorney should be getting involved with. So more to come on that as we have it. Lastly, yet another situation where it appears that the politics is interfering with the science, and that is kind of a good news, bad news thing. So first, the good news, which is that the Novavax COVID-19 vaccine has finally received FDA approval. And so it's no longer under emergency use authorization. So this is very good news because at least in theory, this should make it more accessible and more likely to be covered by insurance. It allows for outreach and advertising and education so that there will be more awareness about the vaccine. And I actually think, especially in this case, this is actually really important because there are people who have no idea about Novavax, even though it has been a very solid option under emergency use authorization for a lot of people. At least anecdotally, it seems to be less reactogenic, so it's kind of less of those side effects that we expect with the mRNA vaccine. So for some people, they would just prefer Novavax. It's an older type of technology. It's the protein subunit-based vaccine. Some people just feel more comfortable with that. And in general, it's just great to have more choice. And so now that the product is fully licensed, it's going to be distributed against the name or under the name Nuvaxovid, and it can now be advertised and there can be more outreach and education around it. So hopefully awareness around it will spread. But what I consider the bad news here is that the approval is limited to people 65 and up, or those 12 to 64 with at least one health condition that will put them at risk for a poor outcome from COVID. It is very unclear why these restrictions are being put in place, and it definitely brings about a serious concern that this is just the direction this administration is going to try to go to limit the availability and recommendations around COVID-19 vaccines in general, or maybe even other vaccines in general, because this doesn't follow any kind of logic or rhyme or reason, since we know that the COVID vaccine reduces the risk of not only it reduces the risk of getting COVID, not as much as we would like. It reduces the risk of poor outcomes across the board. We know that we see poor outcomes even in small children. We've gone over that recently. And so it is not only limited to older adults. And we also know that getting vaccinated reduces the risk of long COVID, which can affect anybody at any age. And so why we would be limiting it somewhat randomly is just not really following any particular logic that I can ascertain here. The FDA also asked Novavax to run more clinical trials after being granted full approval, which is very unusual. Vaccines always continue to undergo monitoring after being approved, but in this case, the FDA is actually requiring additional trials after approval, and those are to be completed over the next few years. So very confusing as to why this is happening. So either Novavax is being singled out for some reason, or this is the direction that things are going to be headed overall. I think neither of those are good scenarios. Now, as a practical matter, I actually think things will be okay. So for starters, once the full licensure is obtained, the vaccine can be recommended by physicians, so-called off-label. And so that just means that it's the provider's discretion whether to recommend it or not. And the reasons could be that the person just prefers it. It could be that the person, had side effects they didn't like with the mRNAs, or it could be that physician has a preference for it and wants to recommend it because they know that it is a perfectly good alternative and it is the one that they have available and they want to get their patients protected. And then even if we have to resort to this one underlying condition for 12 to 64-year-olds, we know that list of underlying conditions is very long, and it's estimated that at least 3/4 of the adult population has something on that list, because it includes everything from being a former smoker to having depression or risk of or having asthma or diabetes, among a whole lot of other things. And it's very unlikely that there's going to be a big process around establishing that. But who knows? The way things are going aren't following logic. So I think we are going to have to wait and see. So having said all that, though, I think that there still is a concern that this is just putting another barrier in place for no reason. So it's going to make it much more difficult, for example, for pharmacists to just be able to give it, because maybe they're going to be asked to ask the patient about underlying conditions. We really don't know how this is going to play out or what those logistics are going to look like. There's also been a concern raised that insurance companies can use these restrictions to limit coverage. I'm not super concerned about that one because Novavax is actually cheaper than the mRNAs, which the insurance companies should definitely like. But oftentimes it has to do with what deals they make with the companies. And so that also remains to be seen. But in general, the insurance companies really do want people to get the COVID vaccine. They're the ones looking at all of the expenses, and they know that the COVID vaccine prevents costly hospitalizations and illnesses. And so they certainly would want folks to get vaccinated. So it's just going to boil down to some of these details. So at the end of the day, my hope and belief is that this won't actually interfere too significantly with access to Novavax. But my big concern really is that this move is a sign of things to come, and that we'll see more interference like this, of just putting arbitrary guidelines and restrictions in place for no apparent reason, just to limit access, which just is very difficult to understand why we would be doing this. And it also just strikes me as being a bit ironic, because the entire platform of a lot of these people who were in charge was supposed to be about medical freedom and wanting to make things more accessible, even down to some of them advocating for ivermectin to be over the counter, which is completely ridiculous. No anti-parasitic medication should be over the counter, but I digress. The past couple of things I reviewed today seem to be moving towards restricting freedom of speech, restricting access to care. And I'm just saying that this is contrary to the stated ideologies of rejecting so-called censorship and embracing so-called medical freedom. So just confusing. So I think amid all of that, the best thing we can do is continue to stay informed, continue to advocate for maintaining access to information, access to care. Let's do what we can to keep ourselves and our loved ones safe and healthy. If we don't have a primary care provider, please get one, develop a relationship with them, make sure you're getting the appropriate screenings based on your age and risk factors. Try to eat a balanced diet, stay well hydrated, quit smoking, avoid alcohol and simple sugars and processed foods and artificial ingredients, eat more whole foods. If you don't feel well, make sure you get your rest. Otherwise, get some regular physical activity. And don't forget to get some fresh air, manage those stress levels, and get a good night's sleep. Next week, we are taking the week off. And so we will see you the first week in June. Thank you so much for joining us. We'll see you again June 3rd.